nurse today. So what is the problems we're having?
Well, I've been coughing for several weeks now,
Okay.
and I've been sleeping really poorly, having night sweats. I'm just really tired during the day. One of the last times I've been looking at my sputum, it's got a lot of blood in it.
Oh, okay. Well, have you been in contact with anybody that's had pneumonia or TB lately?
A few months ago, well, about 8 months ago, I had a test that said that I was positive for TB.
Are you on any medications currently?
Well, I was taking quite a bit of medication once I got through that visit, but I started feeling better, so I just stopped them.
Okay. Well, and that was, how long ago would you say you stopped your meds?
Maybe 2 or 3 months ago.
Okay. So here's what I'm going to do. I'm going to give you a mask, and we're going to get you a private room, and I am going to contact your provider and see if maybe we can get a chest x-ray.
Okay.
Hello, Miss Amy. How are you doing today?
I'm not great. How are you?
All right. We'll sit this here. Now, what brings you here today to see us?
Well, I've been coughing for quite a while now, and I have had a positive TB test.
Okay.
Yeah.
And how long ago was that?
About 2 or 3 months ago.
All
About 8 months ago, I think.
right. Okay.
Yeah.
All right. And what were you complying with taking your medication?
I stopped my meds about 2 or 3 months ago because I started feeling a lot better.
So is that the reason why you stopped taking the better?
Yeah. Well, I did have some very dark urine too, and I thought that that may mean that something was wrong. I was allergic to the medicine, and then I started feeling better anyway. So.
Oh no. That's part of the side effect for one of the medications.
Oh, I didn't know.
All right. I'll put my gloves on here. You mind if I listen to your lungs?
Okay.
All right. Breathe in for me. Good. Get your backside. You did go and have your x-ray done. And I do have your results here.
Okay.
That you do have tuberculosis.
Oh,
All right.
all that.
Yes, the little nodules that confirms that you're positive. Have you been in contact with anyone here lately?
I went to see my husband, and he's currently incarcerated.
Okay.
Yeah.
All right. Well, that is how this transmission goes. You become affected by being around someone that is positive, by inhaling the bacteria. Then it begins to multiply in your lungs. That's why you're having the coughing sound here. Some of the symptoms you already said, you've been having night sweats, the constant coughing. Those are the real major signs of this disease process. All right, being that we know that you're positive, we're going to set up a plan of care.
Okay, thank you.
Thank you.
All right, so Alyssa, you're going to be the nurse on the floor today. So this patient in here has tuberculosis. That's why she's in our negative airflow room.
Okay.
I just wanted to remind you, you have to wear full PPE for airborne precautions. I mean, the shoe covers, a gown, your hairnet, eye protection, and N95 mask like you have on now.
Okay.
It's very important. You don't want to take this home to your family or spread it to other patients, okay?
Okay.
Do you have any questions for me?
I don't think so.
Okay, well, you have my number. Go ahead and call me if you do
Okay.
have any questions. Make sure this room stays shut at all times.
Okay.
And then we're going to do some patient teaching as well to let her know what she has to do, not to spread it further.
Okay.
Okay, thanks.
Sounds good. Thank
Okay.
you.
How are you? I'm Shelby. I'm the infection control manager. I'm a registered nurse, and I need you to know what to do so that this doesn't spread any further, okay?
Okay.
We want you to wear that surgical mask, and that prevents you from spreading the tuberculosis into the air, okay?
At all times?
At all times. If you're alone, do you live by yourself?
No.
Okay, yeah, then we want to do that at all times and stay in your own private room as well. You need to be isolated for 6 weeks at home. I know that's a long time, but it's very important for your family members in the community, okay?
So I shouldn't go visit my husband during this time?
No, ma'am.
Should we?
In fact, we should, our infection control team is already on it. We're getting in contact with the prison to see if there's been an outbreak there, okay?
Okay.
All right, and two, being alone and being isolated will prevent you from getting any opportunistic infections since your immune system is down, okay?
Yeah.
And
Okay.
make sure to take those medications regularly, okay?
But if I start to feel better, I can stop taking the medicine. taking the medicine.
No,
right?
ma'am, that's not the case.
Oh, okay.
Feeling better is a indication that the medication is working, but it has to be completely finished. Tuberculosis is a bacteria, and whenever you allow that medication regimen to be stopped, the bacteria can grow resistant to it. Okay.
Oh.
I'll get Alyssa, our nurse, in here, and she'll explain your medications more.
Thank you all.
Thank you. Hey, Miss Amy, I'm going to be teaching you the importance of this incentive spirometer today. So this is for to help you cough with coughing and deep breathing. Okay. It's important that you do this 10 times an hour.
Oh, wow.
All right. Yep. It's a lot, but it's really going to help you.
Okay.
And help you get discharged home faster. Okay.
Oh, okay.
So you need to sit up in bed when you're doing this to allow your lungs to adequately expand with air, and you're going to put a tight seal around this mouthpiece. Okay. You're going to take a deep breath in, and you're going to hold it for about 5 seconds, and then you're going to exhale.
Okay.
And once again, you're going to do that 10 times every hour. Okay.
Okay.
All right.
All right.
The doctor prescribed some medications.
4 of them there. That's a
Yep,
lot.
4 medications. The names are rifampin, isoniazid, ethambutol, and pyrazinamide. All right, and they need to be taken for 9 to 12 months.
Wow.
And you can't stop them, okay?
Even if I feel good.
Even if you feel good. So
Okay.
normal side effects you're going to see. You're going to see dark urine. You might have yellowing of the skin and the eyes, but that is normal.
Okay.
Okay.
I stopped before because I had dark urine.
Yes, that's normal. And if you have any vision changes though, or blurred vision, that does need to be reported to your doctor, okay? Here you go. And here's some water.
Thank you.
Thank you.
I just want to reiterate that when you go home, you need to be isolated for 6 weeks, and your family members need to be tested, okay? And I think they're in the process of doing that right now, right?
Okay, yes, I think they are.
All right.
Hello, Amy.
Hey.
I'm Breanna, and I'm going to be your discharge nurse today. You've been here for a while now, getting treated, and I know it's about that time to go back home and start your 6-week isolation.
Oh.
So I just wanted to go over a few things and answer some questions if you have any. Do you have any questions about your meds?
Well, she told me that I was supposed to take it on an empty stomach, but is that necessary?
Yes, unfortunately it is. The INH, the one specific med, needs to be taken on an empty stomach.
Okay.
You are also aware of all the signs and symptoms, correct? Like the ones that need to be reported?
Yes. Changes in vision, blurry vision, remember now.
I also want to make you aware of the directly observed therapy that you will be on. There's just someone that's pretty much going to come to your home from a home health agency, and they're going to come and help to ensure that you adhere to your treatment plan so we can get this cleared up as soon as possible for you. Okay, so I brought a pamphlet for you just to go over the importance of this treatment plan and hit on any things that you need to know.
Okay. Thank you.